Okay, friends, welcome once again to the episode number 8 of 26 episode that we have planned for Miraculous Mondays, Management Mondays. So this is episode number 8 today, and I'm back with you can say, a new episode to share something new with you. As usual, all my presentations will always begin with thanking the Lord Almighty, who's given me much more than what I deserve. So this is my brief CV, just to authenticate the point that whatever authority, a little maybe, I hold over delivering such things to you. So 2 weeks back, I had actually planned to take up this topic. I had taken up the ASAP phenomenon by Margaret Sumption, which was an important factor in determining the patient satisfaction module. And I was supposed to take this topic last week, but then desperate advertising took precedence, and I discussed that topic again. There was one element which was closely related to this, so I discussed that. So I'm back again with the top 10 essential elements of patient satisfaction. So let's begin. So we all compare the patient satisfaction to patient experience. There are a lot of things which come handy in that part. And trust me, if I have to break down the patient experience into 5 parts, I would say caring, listening, explaining, teamwork, and efficiency. Of course, I'll further break down in the end part of the presentation. But caring means know me, listening means hear me, explaining means teach me, teamwork means coordinate for me, efficiency make it easy for me. So these are a few things that we'll be discussing in the elements that I'm going to lay out today. So let's come straight to the point and discuss the 10 elements. So communication with the treating dentist. Of course, listening is one of the important parts of the patient care part. We all know that the patients commonly complain that the dentist actually did not listen to them. And when the patient is in a, say, distress mode or a disturbed mode, he wants to spell out even the smallest or the little of the things. And trust me, it takes a lot to give a patient ear to the patient, to hear him or her out. But it actually also decides that you don't miss out on the small little details, which we all are very habitual of missing. And trust me, this part is one of the most important parts. The hear me part is one of the most important parts. Then communication with clinic staff members, the dental assistants. As I discussed in the Margaret Sumption ASAP phenomenon, sometimes the doctor is busy inside the operator. So the first contact of the patient comes to the clinic staff. Can be a receptionist, can be the chairside, or can be the assistant who is manned in the waiting area. Or even if the doc is not there, the dentist is not in the premises, the first is like that. For example, the patient actually comes into your clinic and your staff is not much happy, he's just doing his duties, just doing the normal course, doing the dusting. The patient comes in and you've already informed your staff that, listen, guy, I am going for my kids' parent-teacher meeting today, so I'll be late half an hour. We don't have any appointment scheduled, but if any new walk-in comes, please do handle him or her. So the staff, if he is not in sync with you, the new patient walks in and he is busy doing his dusting or other stuff, whatever he is doing. But then when the patient asks him, Doctor Saab, I nahi aaj, in a tone which is actually not very cordial, the patient again asks, रोज लेट होते हैं कि सिर्फ आज लेट है? डॉक्टर साहब का तो रोज का ही है. These 2-3 words in one line, trust me, can actually make or mar your reputation. So the staff also has to be in sync with that. I talked about one phenomenon where the patient should not be ignored in the waiting area, but this is another phenomenon which can happen in your absence usually. Even if it is in your presence, you make it, you can say, make it mandatory for your staff to acknowledge the patient's presence in the waiting area and make him comfortable. Inform him that whatever time you're going to take, normally or maybe abnormally means in case of an emergency, normally means that you are running late because of any reason, specific reason on that day only. So you need to tell the patient very, very clearly through your chairside assistant. If possible, do it yourself. But if you can't leave the patient, go away. So that communication part with the dental assistant, how you train him, how you don't train. Trust me, many patients not complain, they will say, मैं जिस dentist के पास पहले जाते थे, he was a very good dentist. He used to listen, you can say, very compassionately. But his assistant was weird, not properly dressed. I know we have shortage of labor here. Most of the labor in Punjab is outsourced from UP and Bihar, but he actually didn't seem like a clinic person. So irrespective of the culture, community, or you can say the ethnic background the assistant comes from, you need to make sure that you convey it to the staff that they have to be in sync with that part. So once that is done, you can just be assured that the staff will learn the communication part. The first basic part is that. Then the third aspect of patient satisfaction, communication about the treatment protocols and the informed consent. When you explain these things rightfully, hearing out, drawing a treatment plan, explaining to the patient, doing the legal work formality, of course, informed consent is part of the legal work. And all this to be done in a phased manner. Do not jump on to any of the treatments. Trust me, the commonest thing is मैं गया बैठा बात सुनी ठा ठा करके कर दिया. Yes, 1 or 2 out of 10 might be happy with your super quick attitude, but more or less they will not be happy. They'll say, I wanted to discuss, I wanted to know what is to be done. After all, you are touching my body. Of course, in our case, teeth. You're touching my body, you're touching my teeth. I need to know what is to be done, how is to be done, how much I have to pay, and all the other side effects of the treatment. Of course, covered in the pros and the cons and the consents and the hows and the whys and the do's and the don'ts of consent in that regard. So then these are the three elements: communication with the dentist, communication with the staff, and of course, communication of the things in the rightful manner. Now comes the fourth point: responsive nature of the clinic staff to patient complaint and during treatment sessions. Quick response in this case. How quickly you respond, how quickly your staff responds to patient's complaint, like that. You have told your staff to prepare the patient. Chair lagao, drape lagao, set lagao, and I'll be coming in from the other patient I'm attending. People have multiple chair setup. The patient complains, ये apron थोड़ा मेरे को ठीक नहीं लग रहा, फटा हुआ है, मैला है, गंदा है, whatever reason, या छोटा है, according to maybe the dimension. Some people don't have a universal set in that regard. So please change it. So, और है नहीं है. If that is the answer, yeah, you don't respond, the staff does not respond, yeah, the patient needs some water, he's busy fiddling with his mobile, he's fiddling changing the channel of the TV, not paying attention after doing what the doctor told him to do. And when the patient asks something that the assistant does not respond, that actually sets the tone. When we talk of the internal marketing, these all small little things make a big difference overall. Then the fifth part, the pain management. See, dentists are known to be the healers, but they are also known to be the, you can say, evil forces which give pain in minds of a few patients. It actually is a dentist ke paas nahi jana, bahut dard karte hain. That is what most of the dentists are famous for. And when the patient is having pain during the procedure, koi baat nahi, ho gaya. That ho gaya, koi baat nahi takes sometimes 2 to 3 minutes. Trust me, it is not even easy to bear a pain for 4 to 5 seconds. And कई बार हम pain हो रहा होता है, एक injection, एक LA बचाने के चक्कर में we do not sometimes inject. Always ask, do you want me to be injected even before a normal cavity preparation? Yes, the history part and all those things again aside, I'm not taking the medical history part into here. I believe that is done, that is covered by you already. But how effective is the pain management by you? Even if your injections don't hurt the patient, that is going to give you brownie points in the eyes of the patient. वो डॉक्टर ने इंजेक्शन इतने प्यार से लगाया, इंजेक्शन पेन नहीं कर. That is one big selling point, big satisfaction point. मैं पुराने डेंटिस्ट के बाद काम अच्छा करते थे, बहुत अच्छा करते हैं, पर इंजेक्शन बड़ा painful था. Trust me, your 24 gauge needles, the default needles, are absolutely painful. Absolutely painful. I have borne the pain of them for the past 1.5 years. I know, for my own problem which I had. And my dentist, he's my friend, of course, but 24 gauge, ton. And I was like, थोड़ा तो तरस खाओ यार. मैं पेशेंट को नहीं कभी देता क्लिनिक में, यू आर डूइंग इट, बट नहीं कोई बात नहीं डॉक्टर साहब, हो जाएगा. That attitude, working in a corporate, working in a hospital, working in a private clinic, working in a charitable clinic, all those demand sometimes different faces from us and the different nature, and the ultimate bottom line aim is the cost. Bloody hell, what the cost makes a difference in 5 rupees, 3 rupees, 4 rupees, if you can just impart that thing. Just changing the needle will take 1 rupee 60 paisa, 80 paisa. Can't you do that? Altering just the speed, उसमें तो कोई पैसा नहीं लगता ना, सिर्फ आधा मिनट ज्यादा लगता है. Speed. So these points are very trivial. They may appear very trivial to some, very little points, but they are big deciders of patient satisfaction. How effective as a clinician are you? Then, of course, the superficial factors that I used to always get to ask, I'm asked always, does the clinic decor matter? Yes, cleanliness and calmness of the clinic, how soothing it is. Some instrumental music is playing, the color is not very flashy, not very, you can say, eye catching, or you say eye but disturbing in your clinic. Of course, usually clinics will have soothing sky blues and whites, and you can say those colors, but some of the clinics have some flashy colors which are actually disturbing. Again, these all may not work in, you can say, individual opinion, but they in unison, in a combination of 1 to 2 to 3 factors, they may work big time. So I hope I'm inculcating some sense in you via these factors. So the next factors, the number 7, how updated is the dentist on latest treatment modalities? Trust me, people are a lot aware these days. And a casual remark from a patient, डॉक्टर साहब ये मशीन 10 साल पहले भी यही होती थी, मैं आता था 10 साल बाद भी यही. What message does it send across that you have not changed that one machine which is in display of the patient's eye? ये blinds आपके काफी शुरू से लगे हुए हैं ना क्लिनिक से. It is not a compliment, it is a comment in a sarcastic tone. Try to understand. If you're not upgrading on these things, again, these may be on the treatment modality part, or maybe on the internal marketing parts. Everybody accepts, or you can say expects change. That yes, an element of freshness is induced where he's going. Then the post-operative instructions part by dentist or clinic part, how effective and how smooth. In my clinic, it is, you can say, a no-brainer. My staff would repeat it, but the primary instructions are given by me in my language, the language patient understands. I give it in that sense. I repeat it multiple times. I don't want the patient to face the problem. Follow-up call may be done by my staff, sometimes by me, but these experiences post-operative, how the care factor is there, done. Many times I get the, you can say, response even after major surgery, when we have followed up the patient, told him to say come after 2 days or 3 days and call us in case of any problem. The patient comes after 2 days and says, and we ask, आपने कॉल नहीं किया, आप ठीक रहे, आपने इंस्ट्रक्शन दे दी थी, हमने फॉलो कर ली, कोई प्रॉब्लम आई. This is the way it should be. You should be able to get into the patient's shoes and experience those things which the patients commonly make a mistake. I have seen that happening in my clinic. Sometimes I've extracted, for example, a normal tooth of a male 40-year-old, 35-year-old male patient, mobile tooth, told him the instructions of not spitting, not talking on phone, you can say pressing the cotton. Trust me, just on a very few occasions, I've seen that patient walking out, standing in front of my clinic with the back towards me, talking on phone, hello, and all that, and talking to someone loudly on the same side of extraction. And after that, this is the way, spitting out. What does it do? It immediately spoils 3 instructions on the spot. If this patient develops a dry socket or a bleeding when he goes home, primary thing is bleeding or swelling, and then the dries up maybe later on if the clot is not retained. Who is to be blamed? Technically the patient, because once the patient has a problem, we all go into the blame game. आपने इसमें नहीं किया होगा, आपको बताया था हमने, आपने कब बताया था मुझे, आपने बोला था ये नहीं करना तो मैंने ये किया. And that blame game actually sets a wrong tone, wrong precedent. And that is where the problem comes. The experience, overall experience becomes not very pleasant for the patient. The patient says, yaar, ye apni galti maanne ko tayar. It is always better to admit your mistake if it all has happened at your end. Because ultimately mistake maanne se patient ki takleef kam nahi ho jayegi, but it might soothe him. That yes, we all are human. We forget sometimes, and maybe the doctor generally forget. He's genuinely sorry for that. But when we go on, नहीं ऐसा हो ही नहीं सकता, मेरे क्लिनिक का आज तक रिकॉर्ड है, 20 साल हो गए, किसी को आज तक हमने इंस्ट्रक्शन मिस नहीं करी. अरे भगवान थोड़ा ना हम परफेक्ट है, भगवान भी परफेक्ट नहीं, भगवान को भी रोज मंदिर गुरुद्वारे में गालियां पड़ती. तो why are we trying to be doing that? An admission of you can say an expression of guilt is the best thing for the patient. Then the post-operative follow-up. Once your payment is done, you said patient ka payment khatam, hum jante nahi patient ko. The follow-up part is one of the most important parts. Tell the patient, mentally soothe the patient. In case of any problem, we are there. If your filling done pops up after 7 days, it definitely doesn't have to do with the patient's mistake. It definitely has to be a bonding failure. But who will tell you if you are riding that wave of adamancy? You need to understand after 8 months, 7 months, it cannot be a bonding failure. But after 3, 4, 7, 8, 10 days, it surely can be a bonding failure. Yes, occasionally there might be some other reason. Maybe the tooth structure broke off. Maybe you left the undermining caries. Even that was our mistake. So there can be exceptions, but more or less it is the dentist's fault. But बताए कौन, बिल्ली के गले में घंटी बांधे कौन? The problem is this. As we go in practice, go above in practice means in years and in attitude, we tend to change our attitude as well. We then become or try to think that we are invincible, which is actually not the reason. So a post-operative follow-up is a must. So someone would say, what else is new? ये सबको मुझे पता है. The problem is not कि आपको पता है. The problem is कि how much are you actually following? पता सबको होता है, but follow सारे नहीं करते. So then, of course, by the 10th point, the audience would have the अरे बस करो यार, please मेरी गलतियां बहुत निकाल दी आपने. Those who have an open mind, of course. So, but then what is the overall clinic rating amongst fellow audience? Read patients or on social media. Read in one word Google reviews or 2 words Google reviews, or you can say social media rating. Feedback. Feedback is the breakfast of champions. One of the most common quotes, you all must have heard it. If you're not taking a feedback, you actually are not growing. The feedback can be positive, need not always, can be negative also, need not always be positive. Not everyone would be happy even with your 100% effort. Trust me, I got a feedback from someone. Sir, इधर उधर की बात मत किया करो, सीधा point पे आया. Great. I'm doing these lives as a payback to the society. मैं कोई promotion तो कर नहीं रहा. Somebody saying me this, fine, no problem. I'll try to come on the point straight away. But people will always have something to say. And one who criticizes is the one who can't actually do the same thing what you are doing. But yes, learn to differentiate between a genuine feedback and a non-genuine feedback. I'm not a professional YouTuber. I don't want to be a professional YouTuber. I'm very happy with my dentistry, and whatever I'm doing else from dentistry is my passion. Be it practice management, be it medical legal, be it finance. But this is the way I actually try to give back to my profession. Can be short video, can be webinar. My YouTube channel in the past 1.5 years is a big testimony to that. I don't need in that regard, because I can edit videos, I can make it more attractive, more beautiful. But what is the purpose? What is the purpose? Ultimately, the content does the talk. If I'm just doing the flashy work and I don't have any content, nobody will listen to it. So it is a personal choice. So your feedback and the flip side, the reviews, of course, taking the feedback in a digital format from the patient will set the tone. So all these 10 elements are handy, surely. So if I have to summarize these things in 4 points, as I gave you the 5 at the start, 5, 10, and now 4, the accessibility to services, sorry for the spellings, patient education and information, interpersonal aspects of care, and the technical aspects of care. Accessibility to service means you have all the upgrades and updates available in your practice. Interpersonal aspects, your behavior, your, you can say, talking, your consultation is in a good way. Then the patient education information, you give all the options to the patient. You never ever deny him any of the options, whether you're doing it or not. It is lawfully also needed. Then the technical aspects of care, of course, the medical legal parts and the consent part of other things. So why patient satisfaction should score as a top-notch priority, not for dentists, but for every healthcare personnel, be it the medical, be it the Ayush, or be it anyone else. Because if you satisfy one patient, it reaches potentially 4 new patients. But if you disappoint one patient, it reaches 10 potential patients. Negativity spreads faster. It spreads even faster in our country. It spreads triple faster, you can say, in the era of social media. Thank God, WhatsApp has limited forwards to 5. Otherwise, they used to go to thousands in one click. So we started from here, the patient experience. Caring, know me, listening, hear me, explaining, teach me, teamwork, coordinate for me, efficiency, make it easy for me. Let me just break down these as a carry home game for you today. So know me means, do they care about me as a person? Are they sensitive to my needs? Are they concerned about my questions and worries? Are they friendly and respectful? When I mentioned the formula of S is equal to P minus E, satisfaction is equal to perception minus expectation. These are the expectations in the patient's mind. What you do, he will form a perception out of that, other than the treatment. That is why I say ऐसे भी and वैसे भी. Treatment means ऐसे treatment भी तो तब करवाएगा ना if he gets some satisfaction. Yes, my problem would be attended to. Then hear me. Do they include me in decisions about my care, or they say I am the boss, I'll decide what is best for you? Do they take the time to hear my concerns? Listening is unspoken care. William Osler said this. Listening is unspoken caring. So if you're not listening to your patients, you're actually digging a big hole in your satisfaction quotient. Then teach me. Did they explain my problem or condition? Did I understand my medications? Did I understand my follow-up? Do they use the language I understand? The patient doesn't know English. We are giving the instruction in English. The patient doesn't know Hindi. We are giving the instruction in Hindi. You need to actually take some time. When we are buried in the, you can say busy in the hustle and bustle of clinic, sometimes we ignore these small little points. Then coordinate for me. Was everyone friendly and courteous? Did the right hand know what the left hand was doing? Means your staff, of course. Did the team work together to care for me? The staff is not good. The doctor is very good, but the staff is hardly any caring. The staff doesn't come across even as a, you can say, a staff member. It comes across as a bonded labor. Then make it easy for me, the efficiency wise. How hard was it for me to get in? Now remember the session done 2 weeks back, ASAP phenomenon. How long did I wait? Did they explain delays? All the points of ASAP. Did they respond to my call? How smooth was my discharge? Of course, means in not in the dentistry, of course, we are not admitting patient, but how smooth was the whole process? Then did they follow up with my doctors in case I was on medication, I was a heart patient, I was maybe for a, you can say, taking medication for some disease which required an intervention from my own physician before they could start the treatment. So if I have to break down these 5 elements, I would be giving you matrix. So when I say know your numbers, know yourself, know your numbers. These can be, some of these things can be measured quantitatively. If not all, some of these can be surely. But then you have to understand that if you have to satisfy your patients, you need to actually make all these things easy for the patient. Take it easy, make it easy. Die approach, my approach, as they say. So I hope I have put you in the think mode today. like this Donald Duck. So I hope so, really. So jap naam as usual. So thank you so much for watching. Uh, Definitely, I believe that I have been able to impart you some value. So this is my WhatsApp group. If you are interested in being added, please let me know. I'll add you. The 6th would be the last one. After that, I may shift to Telegram, but I'm not extending beyond 6 because that'll make my life difficult. This is my YouTube channel. As on 15th Feb, there are 422 videos already on the channel. Do subscribe and hit the bell icon. You keep getting multiple videos every week, surely. So do send me your feedback on my cell, on my group, on my page, wherever you're watching it, or in the various groups. Bookers and brickbats both would be welcome in equal measure. Thank you so much. And I stop my share for the questions or for acknowledging all the friends on my wall. Okay. Hello, Dr. Sonia. Hello, Dr. Parul. Hello, Dr. Vrinda. Hello, Dr. Sanyukta. Hi, Ale. Good evening. Hello, Dr. Kuldeep. Hello, Dr. SP. Good evening, Ale. Hello, Dr. Anupama. Hello, Manuji. Hi, Anshul. Hello, Dr. Divyanshu. Hello, Dr. Musa. Thank you, Mayur. Thank you for your feedback. Thank you, Dr. Sonia, for your feedback. So any questions if you have, you can put on the Facebook page where the session is happening. And I'm here for 2 minutes. After that, I'll be winding it up. So please do let me know any questions from your end. So this week, we will not be having a Thunder Thursday session. I have a celebration in my family. So I'll be taking up the Thunder Thursday on the Fantastic Friday. I'll notify in the WhatsApp group wherever you are with me. I'll notify in over there. But this week there is no Thunder Thursday, but Fantastic Friday. So I hope you join me for the finance session on this Friday, surely. So, okay, so there are no questions. Okay, guys, I take your leave and see you on Friday for the Thunder Thursday session this time. Bye bye. Take care. Have a good night and do take good care of yourselves. Bye bye.